Hey everybody, my name's Grant Bledsoe. This is Above the Canopy, and being a Friday, we're doing another Facebook Live. Today's topic is going to be on retirement. More specifically, what should we expect to pay in terms of healthcare costs after we stop working? When we talk about retirement planning, really we're trying to back into how big your nest egg needs to be in order for you to retire, stop working, live off your own assets with enough confidence you'll be able to live with independence and dignity for the rest of your life. There are a lot of variables in retirement planning. We don't know how long you're going to live. We don't know what your investment returns might be. We don't exactly know how much we're going to spend in retirement with inflation. And when we talk about healthcare costs are rising between 5 and 7% each year depending on who you ask. So fortunately for us, there are a couple companies out there that do annual estimates and studies to try to examine exactly how much retiring couples today should expect to pay in terms of healthcare in retirement. One of them is Fidelity. It's a big brokerage firm. You've probably heard of them. The other is HealthView Services, which is actually a healthcare cost projection firm. What HealthView Services thinks, according to their most recent study, is that a 65-year-old couple who is retiring this year, who is eligible for Medicare and enrolls in Parts A, B, D, and gets a Part C Medicare Advantage supplemental plan, so they're covered across the board, should expect to pay $288,400 over the course of their retirement. And we're expecting that our couple lives to their life expectancy, which I believe is 85 for men and 87 for women. What this doesn't cover is a lot of stuff. It doesn't cover dental, it doesn't cover hearing, it doesn't cover vision, and it doesn't cover extra out-of-pocket expenses that our couple might experience. According to HealthView Services, when we incorporate these extra costs, our total rises to $377,000 over the course of their retirement. That's a big number. What HealthView Services also does for us is estimate down the road what a 55-year-old couple today who expects to retire in 10 years at 65 might expect to pay over the course of their retirement when that begins down the road. And given the rising cost of healthcare, they estimate that's going to be about $466,000. What about a 45-year-old couple going to retire in 20 years at age 65? That cost goes all the way up to $592,000. So this is a very significant chunk of change. I don't need to tell you that. Fortunately, there are a few ways that we can park money aside today and take advantage of tax advantage savings that the IRS, that the government lets us use and save money for this expense down the road. Most notably, if you're enrolled in a high deductible health plan, either on your own or through healthcare.gov or through work, you're eligible to contribute to a health savings account. By high deductible healthcare plan, I mean that your individual plan, if you're an individual, the deductible is at least $1,300 in 2017, or for a family, $2,600. What the health savings account allows you to do is park money, save money on a pre-tax basis, just like a 401k, just like an IRA. You can then invest those funds in various mutual funds offered by the bank custodying your health savings account. And then down the road, if you withdraw the funds for qualified medical purposes, which is pretty much anything medically related, you can pull them out tax-free. So you get tax-free contributions, tax-free growth, tax-free withdrawals. That's about the best savings deal there is. So the point of all this is, yes, we know that healthcare is going to be a big expense in retirement, but if you have access to a health savings account, park as much money in there as you can now, because I promise it'll pay dividends down the road. That's it for today. Make sure you pop over to abovethecanopy.us, subscribe to the blog, and you get free access to the Financial Independence Vault.